Hey y'all, welcome back. I'm Mama Dr. Jones, a board certified ObGyn, a mom to 4, and today we're talking about postpartum depression. I just finished up doing an interview with Ned and Ariel Fulmer of the Try Guys and the Try Wives and the podcast Baby Steps, which is where they'll be broadcasting our discussion. It was all about postpartum depression and postpartum anxiety, and it was such a great conversation that I just wanted to hop on here and talk a little bit about these topics with you all. Postpartum depression is something that is relatively common. About 1 in 10 will experience this after giving birth. And that's why it's so incredibly important that we bring awareness to the issue. What exactly is postpartum depression? Postpartum depression is a series of several different symptoms, anything from just feeling uninterested to having excess guilt, or even changes in your sleep habits or changes in your appetite. And these have to go on for a period of at least 2 weeks. To be postpartum depression, it has to occur during the 12 months after delivery, but there's also a perinatal depression which can occur during pregnancy. And I think it's really important that we highlight that, and we'll talk a little bit more about it in just a minute. What's the difference between postpartum depression and baby blues? You've all heard about baby blues, and we've all been told like it's kind of a normal thing. And baby blues is super common. This is something that happens in almost everybody to some extent after they deliver. It's kind of an onset of crying and mood lability and just not feeling quite right, or sadness that happens about 2 days after delivery, sometimes 3. But of note, baby blues should end at the 2-week mark. If you have ongoing symptoms after that, or if your symptoms are severe and interfering with your daily life, your ability to take care of and bond with baby, this is very important for your doctor to know. Postpartum anxiety is really similar to postpartum depression and has kind of the same diagnostic criteria, with the 2 weeks and being present most of the day, interfering with your ability to do normal day-to-day life. But the overwhelming feelings there are anxiety and worry instead of the depression symptoms. These can coexist, they overlap, there's kind of a gray area in between, and so it's important that we talk about both of them. They're both treated pretty similarly. The best treatment for postpartum depression and postpartum anxiety is going to be therapy. Sometimes we need to mix that with a medication, and we can find a medication that is safe for pregnancy or breastfeeding. So when should you bring it up with your doctor or advanced practice provider? Most of us should be doing an Edinburgh Depression Scale or some form of depression anxiety screening at your postpartum visits. For me personally, my kid's pediatrician would always give me a depression scale to fill out at every newborn visit. And I thought this was such a great idea, because you always see the pediatrician more than the doctor who delivered your baby or the midwife who delivered your baby. And don't get me started on that. We need a different formulation of postpartum care in this country, with nurses or midwives who can come to your home and see you, or at least get you in for a visit more frequently. But beside that, since we don't have that now, while we're working towards improved postpartum care for people in this country, at the very minimum, I think this is a great idea to be screening for depression at the pediatrician visits. Our doctor would just send that over, so she would take care of some of my patients, and when she would find a positive depression screen, she would send it over. We would contact the patient and get them in for a visit or get them set up with a therapist. I think it's really important to have an open line of conversation with your partner. And if you are the partner in the relationship, if you notice something that's just not right, you don't think that, everything seems to be going normally, they seem to be feeling guilty or not able to take care of the baby or take care of themselves like they should be, you know your partner pretty well. And I want you to feel comfortable bringing this up with your partner or with their doctor, because sometimes when you have postpartum depression or anxiety, you don't always have great insight into that. Some people do. Some people know something's not right and they need to get it taken care of, or at least bring it up and talk about it. And other people just don't understand that it's not just normal adjustment to having a baby. Although it's really difficult to talk about, suicide is one of the #1 killers in the postpartum period. And I think this is important to bring up because it's something that we can prevent with the right measures. So any thoughts of harming yourself, harming the baby, any plans to do any of those things, this is an emergency and a reason to call 911 or go to the emergency room. Don't wait until your next visit. Don't wait until normal office hours. You need to be seen immediately. I also think it's really important for us to normalize bringing up these feelings. If you've been having feelings like that or thoughts like that and they're intrusive, talk to your doctor about it. I know a lot of people feel uncomfortable because it has been made out to be this shaming part of society, but it's not shameful. Nobody wants this to happen, and it certainly does not mean you're a bad parent. So I want everybody to feel comfortable talking about this and seeking help. How long does postpartum depression last? Postpartum depression can last for a while in some people. If someone is doing therapy and medications, in my clinic, I generally have them do that for at least 6 months, and then we can trial a period off of the medication, and I leave the cessation of therapy up to their therapist. For the medication, we can do a trial off for a while and see how you do at 6 months if you feel like that's what you want to do, but sometimes people want to continue it for a little bit longer. About 50% of people who are diagnosed with postpartum depression or anxiety will have symptoms for at least a year, and so I think it's always okay to continue your treatment for that year and see where you are. At that point, we can reevaluate. Some people would like to stay on the medication, they feel good on it, they're stable on it, and other people would like to have a trial off of it, and that's totally fine too. I do want to highlight that medication isn't required for everybody who has postpartum depression or anxiety, and a lot of times therapy will be sufficient. I definitely love to take advantage of any referrals that I can. Any of my friends in psychology, psychiatry, mental health of any kind, I would love for all of my patients to have access to that. That's not always practical, but it would be in an ideal world. And I think that the value of mental health professionals cannot be overstated. These people are wonderful and they're so great, especially for things like postpartum depression and anxiety. The most important thing I want you to know about this is that it doesn't reflect on your ability to be a parent. It doesn't mean that you're a bad parent, even if you're having intrusive thoughts or problems with taking care of your baby. It just means you might need a little help to get better so that you can be the best parent that you want to be. At the end of the day, the most important thing in this conversation is to know that postpartum depression and anxiety is not caused by anything that you did. It just happens. People who've had a history of depression or anxiety are at an increased risk. People who have really complicated pregnancies or traumatic deliveries are at an increased risk. These things are risk factors, but that doesn't mean those are the only people who get postpartum depression and anxiety. Anybody can have this, and in nobody is it a reflection of anything that you've done or something you could have done better. It's just something that happens. So I want to normalize bringing this up, having the conversations, and talking it out with your doctor. Thanks for being here today, y'all. I will link another video right over here. I never know which way to point in this. Somewhere I will link another video, and I will see you next Monday.